community, and also to advance the nursing profession while basically changing the education system to meet the demands of healthcare. Some of these recommended changes, again, are basically just outlining the blueprint that was stated. And another objective of this report is to try to retain well-trained nurses and not have nurses move on to other professions. So I'll start with one of the first recommendations, which is to remove the scope of practice barriers that are faced by the advanced practice nurses, with the purpose being that they can basically practice to the full extent of their education and training and experience. But in order for that to happen, there has to be some national changes, and those changes need to come from basically Congress making amendments to Medicare, first so that the services that are provided by an advanced practice nurse would be covered by Medicare, just like they are for any primary care physician right now. So that would require some amendments. Also amend Medicare to allow the advanced practice nurse to do admission assessments, also certify which patients would be appropriate to go to skilled nursing facilities or hospice, and receive some other services that right now they wouldn't receive any reimbursement for. Also, Congress should extend the increase in Medicaid reimbursement that physicians are seeing, so that it also is covered to services provided by nurse practitioners. And by doing so, it would allow nurse practitioners to basically practice more, see more patients, and have a bigger role in the community. And also, another recommendation would be to have Medicare amended so that nurse practitioners have clinical privileges and basically form part of a medical staff, a medical referring to physicians, but allowing the nurse practitioners to participate in and receive reimbursement for their services. The second recommendation is to basically expand collaborative and leadership opportunities. And this refers to basically we're at a point where some changes need to be made, and simply put, nursing schools, healthcare organizations, public and private funders need to get nurses involved in planning for the changes, and also being involved in the implementation and evaluation of certain changes. And when there's a successful or a promising potential proposal that's made, then just simply allowing nurses to be involved in collaborating with physicians and researchers in leading that change in a way that would benefit the healthcare system. And also another part of that is that nursing schools should begin to include in the curriculum entrepreneurial and business courses that would allow for professional development of nurses, and to basically initiate businesses that would also contribute to the healthcare system.
So I did recommendation number 3, and which was to implement nurse residency programs. So nurse residency programs are basically offered usually after a bachelor's, after you've completed a bachelor's program or a master's program, and usually they last from like 6 months to a year, depending on the program you do sign up for. So what that does is it basically prepares new grads for to be more competent as a new provider or new nurse. So some of the actions that they thought during the meeting that they thought should be implemented to support these nurse residency programs were to basically have like large organizations such as like the State Board of Nursing, healthcare organizations, joint commissions, just to have them basically support these new, just basically have them support nurse students that are completing these nurse residency programs, and to have them support them in their transition into the new clinical practice. Another thing they talked about was basically redirecting all the graduate education fund from the diploma nursing programs, and just have them implement them towards nurse residency programs in rural areas or more like areas that actually need it. Also, they talked about and expanding nurse residency programs in all practice settings. Not right as of right now. I think there's a lot of them in like the hospital settings. So they want to expand it into like community and public healthcare settings, long-term healthcare facilities, home settings, and school settings. And the last thing they talked about for this recommendation was just having healthcare organizations, like the places that do offer these nurse residency programs, to have them evaluate their program to make sure they're actually effective. And with that, it can actually improve patient outcomes and improve the retention of nurses. Recommendation number four talked about increasing the proportion of nurses with a bachelor's degree to 80% by 2020. So as of 2010, it was at 50%, so they want to increase it by 30% to 80% by 2020. And they also, doing that, they want to do that because they want to make sure that they're creating a well-prepared workforce, to meet the demands of the increasing diverse population that's happening right now. The BSNs, they believe that nurses with a BSN are, better. They have better skills in communication, problem solving, making nursing diagnosis, and determining evaluations. There's also improved patient outcomes for nurses who have BSN degrees, and also several states are requiring that nurses obtain their BSN, as well as employers. It's, they're demanding that nurses get, their BSN. So some of the actions that they thought that would help with this specific area would be to have healthcare organizations. Now, when you're done with school, basically you want to get a job, and so a lot of nurses who have degrees and stuff like that, they don't have time to go back to school and stuff like that, or there's other various reasons. But then what they thought it was to encourage these nurses to return back to school was to have healthcare organizations encourage the nurses with associates or diplomas to have them go back into school to get their bachelor's within 5 years, and continue their education. So I guess in order for them to do that, they thought of ways to encourage them in maybe offering tuition reimbursement, expanding on loans and grants, offering scholarships, loan forgiveness, maybe increasing the faculty, because a lot of students are not getting accepted into programs because they're short staffed, and also expanding on clinical partnerships. And they also talked about having academic leaders partnering with healthcare organizations and community organizations to recruit and advance the diverse nursing students. So that was it for recommendation number 4. And then number 5, they talked about doubling the number of nurses with a doctorate by 2020. And they also focused in a lot on increasing diversity as well. They believe that nurses should take greater responsibility in healthcare to achieve higher education, and training through improved education. So they talked about a couple actions that they would take to implement this plan. And one of the ways is to have accrediting bodies such as CCNE, and which stands for Commission on Collegiate Nursing Education, as well as National League for Nursing Accrediting Commission, NLN, to have them monitor the progression of nursing schools to ensure that at least 10% of people who are graduating with their bachelor's enroll into a master's or doctorate program within 5 years. And so that's one of the ways. And then a second way was just basically expanding funding, to expand funding for programs who offer accelerated graduate degrees. And by doing that, they'll there will be an increase in production of master's and doctoral prepared nurses, as well as they're going to also be able to increase the diversity of the faculty and scientists and researchers.
Excellent.
So, the recommendation number 5 from the national IOM is that was engaging the lifelong learning for all the nursing students or faculties or the actual nurses. So in order to do that, for the nursing schools, we're trying to build a curriculum which is updated to the most recent. We see provide a clinical performance competency program for our students, and it should be always checked and evaluated regularly. In order to nurse to engage in lifelong learnings, we're providing the continuing education program for all the nurses. That was had the time and also have the cutting edge competency to complete all the continuation program for lifelong learning. For the faculties, we're giving them the continuation education programs as well to provide a practice that was telling them how to research, how to teach, how to practice with the competency program. Also, because since the society is getting more diversity with the different cultures, so we also require all the nursing education program, all the schools, and also all the facilities to foster a cultural competence in learning for even a nurse or in the professional levels of all the other faculties and stuffs to engage in the programs. The next recommendation from the IOM is the lead the change to the advanced health, which of course is done by nurse. And in order to do that, first, as a nurse, our nurse should be responsible for the continual education, also trying to developing and exercise our skills for the leadership. Then the second way is we have more nursing associates to provide the programs that relate to the leadership program for all the current nurse or the nursing students. Finally, as we are doing right now, as an education program school for nursing, we have to provide our students a more leadership class and business practice class in the curriculum. And finally, as a decision maker, we should focus more to promote the nursing leadership in the future to lead to the advanced health. The last recommendation from the IOM for the future of nursing is to build an infrastructure for an analysis collection. So this is a very interesting theory. So what they are trying to do is they are trying to build up a data, which is we call the minimum data selection, which is going to include all the demographic, skill, role, race, geographic information of a study for a certain demographic area. By building this analysis minimum set data, then we can have the workforce commitment for the some nursing association to monitor the and analyze the needs of a certain area by their demographic or the skills of the nurse or what kind of aspect they lack, so we can improve more health professions to that demographic area. And but in order to do that, we also need to allow the nursing representative from government, decisional, or like educational, all the decision makers that could be represented as our nursing advantage to achieve this outcome. So that's the national level.